All right, today we're cracking open what is arguably the heart of any drug submission, Module 5. I mean, this is it. This is where you tell the complete story of how your medicine performs in actual human beings, from that very first dose all the way to getting that final green light. So if you're getting your feet wet in the regulatory world, listen up, because this module, it's the one you absolutely have to get right.
So, here's our game plan. We'll kick things off with what Module 5 even is, and then we're going to walk through the story exactly as it's told, from those early foundational studies to that first test in patients, then the huge pivotal trials, and even what happens after a drug is approved. Sound good? Let's dive in.
Okay, so let's get right to the core of it. What's the fundamental question Module 5 is trying to answer? It's this. What is the complete story of this new medicine in humans?
And the answer, you guessed it, is Module 5. Think of it as the ultimate human evidence package. And I really mean that. It's not just some dusty folder of files, no. It's the home for every single clinical study report, we call them CSRs, for every single trial you've run. We're talking from that first tiny dose in a few volunteers all the way up to those massive, globe-spanning studies. If it happened in a person, the full, unabridged story is right here.
All right, first up, the foundational studies. Before we can even begin to ask the big question, does this thing actually work? We have to nail down the basics. How does the drug and the human body even interact? This stuff is literally the bedrock for everything that comes after.
And really, it all boils down to three super simple questions. 1. Does it even get in? 2. Once it's in, where does it go? And 3. What does it do? These are the questions that drive all those early human studies, the ones that fill out the very first sections of Module 5.
And to answer those, we break it down into 3 key areas, and each gets its own spot in the eCTD. So you've got biopharmaceutics in Section 5.3.1. That's all about absorption. Then there's pharmacokinetics, or PK, in 5.3.2. That's just a fancy way of saying what the body does to the drug. And then you have pharmacodynamics, or PD, in 5.3.3, which is the flip side, what the drug does to the body. Okay, that's a lot of jargon, so let's make it real with a fun analogy. Let's say we've invented popcorn medicine, a new painkiller. These foundational studies are where we'd prove that our little sachet actually delivers, say, 65% of the good stuff into the bloodstream. Boom, that's its bioavailability. Then we'd show it has an 8-hour half-life, that's the PK part, and finally, we'd prove it actually blocks the pain enzyme we're targeting, and that, my friends, is its PD. Now there's a really important concept here called bioequivalence. This is a big one. So often, you'll change how the drug is made as you go through development. Maybe you used a sachet in Phase 2, but now you want a nice, clean capsule for Phase 3. Well, you have to prove they work the same. A bioequivalence study, or a BE study, is the critical bridge that connects those two. It proves both the sachet and the capsule deliver the medicine to the body in exactly the same way. And trust me, without that bridge, all that precious data from your Phase 2 dose finding, it's basically useless for Phase 3.
Okay, so we've got the basics down in healthy volunteers. Now we move on to the next, absolutely critical step. For the very first time, we're giving the medicine to the people it's meant to help. This is it. The Phase 2 decision point. And honestly, it's make or break.
This is where we ask the multi-million-dollar question, maybe even billion-dollar question. And the answer lives in Section 5.3.4, where all the Phase 2 study reports are filed. After all that work, all the lab tests, all the early trials, does this thing actually work in patients?
And the stakes could not be higher. Get this, something like 60 to 70% of all drugs that make it to Phase 2 fail. They just don't work. So that Phase 2 CSR becomes this huge go, no-go document. You have to see a clear signal of success here to justify spending the hundreds of millions of dollars it's going to take to run Phase 3.
And that brings us to the main event, the big show, the pivotal trials. Look, if Phase 2 was the hint, the whisper of efficacy, then Phase 3 is the definitive, shouting from the rooftops proof. This is where you bring out the big guns and the full weight of your evidence.
And I am not exaggerating when I say this is where approvals are won or lost. Section 5.3.5, where the Phase 3 pivotal trial reports live, this is the section that regulators will pore over with a fine-tooth comb. This is it. The whole game is right here.
And each one of these trials gets documented in this massive, standardized report, the CSR we mentioned, all structured according to the ICH E3 guideline. It's got a synopsis, kind of like the executive summary. Then it dives deep into who was in the trial, and of course, the exhaustive breakdown of whether it worked and whether it was safe. And the appendices? Oh, the appendices. We're talking thousands upon thousands of pages of raw data for every single patient.
So you might think, okay, we got the approval, we're done, right? Not so fast. The story isn't over. In fact, a whole new chapter of data collection starts after the medicine is launched.
So is that it? Is the story over once you get that marketing authorization? Are we done collecting evidence?
Not even close. That's what Section 5.3.6 is for. It covers everything that happens post-marketing. This is where you'll put your Phase 4 studies. Those are often promises you make to regulators to get the approval. You'll also see things called post-authorization safety studies, or PAS, and efficacy studies, PAS. The point is, learning about your medicine never, ever stops.
Okay, so let's pull back and look at the big picture. We've talked about all these different sections, all these different studies, but the key thing to realize is that they aren't just separate files. When you put them all together, Module 5 tells one single, powerful chronological story.
Let's bring back our popcorn medicine one last time to see the whole journey. See, we start in 5.3.1 by proving it gets absorbed. Then in 5.3.2 and 3, we show how it moves through the body and what it does. In 5.3.4, we get that first exciting proof that it works in patients. Then, bam, in 5.3.5, we hit them with the definitive Phase 3 data. And we wrap it all up in 5.3.6 by showing its long-term safety. See how that flows? Each piece builds perfectly on the one before it.
And that right there is the key takeaway. Module 5 isn't a filing cabinet. It's a story. It's the complete, auditable, step-by-step human evidence package that you present to regulators to prove, beyond a shadow of a doubt, that your medicine works and is safe.
And once you understand that structure, that narrative flow, you have the key to building a truly compelling submission. Every single report, every data point, it all has a role to play in telling that one convincing story. So as you start putting together your next submission, just ask yourself this: what story is your Module 5 going to tell?